So my name's Craig Hodges, Group Chief Executive of the Best Practice Software Group of Companies, and really enjoying the chance at the BP Premier Summit 2025, talk to customers, listen to their feedback, and also share some of our initiatives.
Amazing.
Jessica White, Executive Director, recent title change, which is really exciting, of Partners and Strategies. So my team's responsible for looking after all of our wonderful partners, so all the partners here today in exhibition space, and all of our government initiatives.
Yeah. Super cool. It's great to have you here, and I feel like I've only got you a couple of minutes until you rush off to the next thing, because it's been... tell me about the last couple of days here at the Best Practice Summit. How's it been?
We kind of thought of this event as a great opportunity to share some of our initiatives and, what we're doing with Journey to the Cloud, some of our interoperability plans, and also how we're delivering services to better pivot to meet our customers. But it's just as much about hearing from them. And they've shared some really great feedback with us about things we're doing well, areas we need to improve. We are receptive to that. And we're really all ears this weekend to help make sure we pivot and meet their expectations too.
Couldn't agree more. And I think the biggest thing for me is general practice is still such a fragmented process from a innovation and digital health perspective. So having events like this, it brings all of our exhibitors together, all the people providing the health technology solutions to our GPs, all in the one place. So practices can actually start picturing together what they need at their practice, what products are available, what's going to help them deliver healthcare.
Yeah.
Whilst interoperability's on the way up, we've got Sparked initiatives and FHIR and all these amazing things are still in silos. And bringing everyone together, what I feel is the GP Health Tech conference, really, because there's really no innovation conference for GPs, allows our customers to kind of look for the best products for their clinic, make sure they're using the right products, and kind of speak to all the same people in the right room, as well as all the stuff that Craig said about engaging with us in our business and learning what we're doing. Giving back, I think, to our customers is really important to BP. They have had such a huge responsibility in the general practice world. In fact, I talk to a lot of our specialist colleagues who deliver specialist products, and they can't believe how much industry change we have to go through in the general practice world. They're really kind of the centre of the healthcare ecosystem. Everyone's kind of feeding into them and wanting more and more from them. So having events like this is really important, just so that we can really support them with what they do. And there is so much change. And we feel overwhelmed by it, and I can't believe or imagine how they would be feeling about it.
No, look, there's a lot to unpack in that in itself, but I'm reflecting too, Craig, last night at the gala dinner, it was a great opportunity to hear from Frank and Lorraine Pye-Finch up on stage in the interview and the conversation you had with them. And there's something in that too about the culture that's been instilled through, from their initial vision and that whole journey of bringing up basically practice management systems into general practice into Australia. And, to the point we are today in 2025 with best practice with, the great team that's supporting everything. What's your reflection on, that initial kind of vision that Frank and Lorraine kind of unpacked last night to where best practice is today and then what happens next?
It's such a humbling story to not only be part of, but to hear from their words as well.
Yeah.
That, a software developed with the very best intention to make the GP's workflow and life easier, written by a GP for GPs, which makes the world of difference. And to hear that and be part of that journey and see the business change and evolve and grow, from one office of 9 people to 273 in 4 offices in 2 countries. The growth chart's been immense, but we've kept true to our values. And the very first is we value our customers. So events like this are that great connection to make sure that no matter how we grow and diversify and go in whatever channel, we will always have that conversation with people. And I think that's what sets best practice apart and makes it such an important contributor to the GP community.
100%. And lastly, Jess, you've obviously heard from participants and GPs asking questions during the plenaries, as you would have to, Craig, but also just hearing the discussions that the software community and the partners are having with attendees. Are there one or two kind of, I might get both of your perspectives actually, one or two key trends or recurring topics, or for someone that might not have attended the Best Practice Summit and wanted to kind of sneak into what the hot topics are in general practice land now? I mean, it's all being discussed here. Anything that's come front of mind for you?
Yeah, definitely. I think probably AI has been the hot topic of the conference, and that was obviously expected.
Yeah.
We know that it's evolving. We know that it's still, people are treading really cautiously, but at the same time, practices are looking for efficiency, and that's where AI steps in. They're really busy. As I said, there's lots of industry change happening at the moment, and they want tools like AI to come in and, help them with scanning and help them write their notes and help them manage their appointment book, not take away from their clinical decision making or from treatment of the patient. But practices are here looking for efficiencies because they run lean, they have a lot of overhead. We know that the funding models in general practice haven't actually kept up with inflation. So they're coming here looking for efficiencies, not to cut staff or anything like that, but to redeploy those staff to other jobs that can help them assist their patients, generate revenue, and do additional activities within the practice. So I think a big theme for us has been efficiency and obviously keeping up to date with trends, standards, what's happening in fire, what's happening with BP and our cloud journey, making sure they're making the right decisions for their business now that are going to make sense in 5 years.
Yeah, absolutely.
I think it's all about taking people on that journey with us. And, as I mentioned in my plenary yesterday, that we're receptive that 2025 is tough. This is a tough time for GP world. So, we want to help play that role to make life more efficient for them. And sometimes it's all about, as Jess mentioned, getting them to do what they do best. And sometimes it's not that back office administration side or, the time consuming side that tools like AI can help mediate.
Yeah. And actually, one other question I'm thinking about from a best practice side, once all of the packing up and everything is done here from the summit, what happens next for you and the team? Like, what are the priorities over the next couple of months following the summit?
Yeah, so, we've taken notes galore from people. We've made some really great connections with people that we want to keep that conversation going. Yeah. And this afternoon, I'll be inviting people. Make sure you let us know. We have an open door in terms of what features or functions do you want, but we'll assess those against not only market need, but also capacity in terms of what we got coming. So, it's not the only opportunity people have to talk to us. We want to keep that going, and we'll make any assessment we can about where the future of the products are going and what features you'll see come online.